Did you know that more than 300,000 people have hip replacements each year in the United States? Well, with the number of these surgical procedures on the rise, it's important to understand how it can be beneficial and when the optimal time might be to fix your hip issues. Here with the answers is Dr. Brian Palumbo. He's the medical director from Florida Hospital Tampa Orthopedic Care Center. And welcome, doctor.
Thank you for having me.
Of
it's course.
Great to be here. Yeah, nice to have you. You know, so many people suffer from arthritis. They have it in various parts of their body. When it strikes the hip, when is it the right time to come and see you, a doctor like you, in order to perhaps understand what's going on and sort of plan the treatment route?
Sure, thanks. Yeah, I think generally when it involves the hip, there's a variety of symptoms that can occur, and sometimes it's challenging to diagnose and tease out other issues, such as maybe back pain. So I think when you start to have pain in that area, it's probably good to start off by seeing your primary care physician, usually getting a simple set of x-rays and having a straightforward evaluation. And then from there, if you're diagnosed with arthritis or other pathologies of the hip, then you'll want to probably see an orthopedic specialist.
Okay, let's talk prevention, because a lot of us are weekend warriors. We want to exercise, we want to stay active as we get older. What types of things do you recommend we do at this point before the hip problems start?
Sure, I mean that's a great question, and really a common theme that I speak to my patients about. A lot of this stuff is basic. So frankly, maintaining a healthy weight. For every pound you have extra on your body is about 5 to 7 pounds on your hip. So simply losing 10 pounds, you can lose 50 pounds off your hip joint, which makes obviously a huge difference. Strength training. I mean, it's challenging, especially if you're a weekend warrior, just to go out, especially if you're not very active throughout the week. It's really challenging to do some of these exercises, such as mud runs whatsoever. So I think the kind of the one advice I would give is make sure you're doing strengthening exercises, flexibility training, and those sorts of things. You want to have a really consistent regimen. I think going out on the weekend and just doing some of these extensive training or regimens is probably deleterious for the joint.
So keep it moving, but don't necessarily overdo it.
Exactly.
Is what you're saying. All right, now there seems to be a lot of different types of hip replacements, new technologies. How does a patient know what's right for them when and if the time comes that you do have to deal with that?
I think the short answer is to speak with your surgeon. I think it's important, especially when dealing with hip and knee arthritis and finding an orthopedic surgeon. I think one of the most important things is finding a fellowship-trained orthopedic surgeon who's doing a relatively high volume, has a relatively high volume hip and knee practice. That surgeon usually is going to be able to guide you in terms of the right techniques, the right implants for that specific scenario. Sometimes the orthopedic community, we do get caught up in trends and maybe fads, and this may not be the right thing for the patient. I think that's why it's really important to have somebody who is fellowship trained and knows the nuances of implants, implant design, patient factors, and those things.
All right, doctor, I really appreciate all your information. And to schedule an appointment with this fine doctor right now, just call the Florida Hospital Tampa Orthopedic Care Center at the number right there on your screen, 813-615-7087, and the website is there, fhtampa.org. And Dr. Brian Palumbo, thanks so much.
For having me. Pleasure.
Of course.
Thank you.
Pleasure was ours. Cindy, over to you.
In a world filled with technology, Spectrum delivers. With superior HD picture and sound and the fast